Alright, team. We have a tough case on our hands. The symptoms are condensing osseous, epoxyeicosatrienoic acid, and dactylides.
Those are quite specific symptoms. It could be a number of rare diseases.
I'm leaning towards thinking it's an autoimmune disorder, given the symptoms presented.
I disagree. These symptoms could also be indicative of a genetic neurological condition.
I'm not entirely sure, but I think we need to run more tests before jumping to conclusions.
Enough. I've seen these symptoms before, and I'm certain it's Makado, Joseph disease. We need to act fast. Pancreatectomy is the way to go. It's risky, but necessary.
But doctor, that surgery is extremely risky and could endanger the patient's life.
Are you sure about this, Hawks? We should consider other options.
I'm not convinced this is the right approach, but if you're certain, we'll proceed with the pancreatectomy.
I trust your judgment, Hawks. Let's prepare for the surgery.
Tracy, you called me into your office regarding the pancreatectomy I suggested for my patient with suspected Makado, Joseph disease.
Yes, Hawks. I have serious concerns about this procedure. Are you sure it's the best course of action?
I have years of experience in this field, Tracy. I know what I'm doing.
You may have experience, but let's not forget your track record. You've been wrong before, Hawks.
That was a different scenario, Tracy. This is my patient's best chance at survival.
I understand your determination, Hawks, but we need to consider all options before proceeding with such a risky surgery.
I appreciate your concern, Tracy, but trust me on this. I can save this patient's life with the pancreatectomy.
Leslie, the patient is in critical condition. We need to talk to Hawks and explain that the pancreatectomy was not the right treatment for Machado. Joseph disease.
I understand your concerns, Frank, but right now we need to focus on saving the patient. Hawks can be informed later. Our priority should be the patient's well-being.
I know, but we can't hide the truth. Hawks needs to know the mistake that was made so we can work together to find a solution.
I agree that transparency is important, but at this moment our energy should be directed towards the patient. Let's stabilize them first, then we can have that conversation with Hawks.
All right, let's focus on the patient for now. We'll deal with informing Hawks later.
Thanks for keeping me grounded, Leslie.
What were you thinking? You nearly killed our patient because you chose the wrong pancreatectomy and misdiagnosed the condition.
But Dr. Hawks, we thought we had the right approach based on the symptoms presented.
I still believe my diagnosis was accurate, given the information we had.
I don't know, maybe we missed something crucial during the evaluation process.
I agree. We might need to reassess our diagnostic methods for future cases.
You morons. You are all incompetent. I can't believe I have to work with such a bunch of clueless imbeciles. Figure out the correct diagnosis and treatment plan before it's too late. I'm out of here. So, Johnson, how's everything going outside of work? Any exciting plans for the weekend?
You know, same old, same old. Just hanging out with the family, maybe catching a movie.
That's nice. I've been so engrossed in this case lately, it's been hard to focus on much else.
Yeah, I can see that. You've been pulling some late nights trying to crack it, huh?
Actually, I think I just had a breakthrough. It all makes sense now. Thanks for the chat, Johnson.
Wait, what? You can't just leave me hanging like that. What about our lunch?
Sorry, Johnson. Duty calls.
I'll catch up with you later.
I have some urgent news. We need to shift our focus from Makado, Joseph disease, to anencephaly.
Hawks, what in the world are you doing storming in here without Pee-Pee? Are you out of your mind?
This is unacceptable, Hawks. You're putting us all at risk.
Listen, Makado, Joseph disease was a misdiagnosis. Trust me on this one.
But what about anencephaly? What's the prognosis?
The prognosis for anencephaly is poor. It's a severe birth defect affecting the cervical spine. The chances of survival are slim.
We'll have to prepare ourselves for some challenging cases ahead if Hawks is correct.
We need to act fast, make sure our patients get the right treatment. Time is of the essence. Tracy, I finally found the right diagnosis for the patient.
That's great news, Hawks. Well done.
It wouldn't have gone so wrong if I didn't have a team of incompetent doctors.
What do you mean by that? You were the one who declared the wrong diagnosis.
Well, my diagnostics team should have caught that error.
No, you should have. You can't blame others for your mistakes.
Stands up abruptly. I've had enough of this, Tracy. I'm out.